Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Nick Circolone. I am so excited to be here as always, and thank you so much for tuning in. Don't forget to subscribe to our channel and to hit that notification button to check out the new videos that are coming out. Today, what I want to be talking about is wrist and elbow pain. We've talked about this before, but today I want to give you some exercises that you can do and how to stabilize that area. And we'll talk about the difference between stabilization and immobilization, because there is a huge difference. But first, let's get started. The wrist and the elbow seem to take a lot of pressure and a lot of damage because of everyday things that we do. Whether we're working with hammers, screwdrivers, any kind of tool. If you're a gardener, if you're out pulling weeds, planting, all of this will cause wrist and elbow pain. A lot of times we'll have pain in the wrist right around this area here. Sometimes we'll have it here and it'll go into our thumb. Sometimes we'll have that elbow pain, which will shoot pain down into the wrist and into the hands. Now, some of this could be carpal tunnel, but most of the time it is what's known as repetitive strain. So today what I want to do is I want to talk about how to prevent getting pain, and number two, if we do have pain, what can we do to relieve it? Well, the first thing is, if you want to relieve the pain, we'll have to do some stretches and some exercises to help that. But to avoid it, the only thing we can do is to stop that activity. Sometimes stopping that activity for a short period of time will be enough for that area to heal. Even if we stop that activity, we still need to keep in mind about stretching and exercising the area, because eventually you're going to go back to doing that activity. Most of the time we can't stop what we're doing. If we like to garden, if we work with tools, it's unavoidable that we're going to start having wrist and elbow pain. Now, you can take something to help with the pain. I'm a big believer in B vitamins. The best way to take the B vitamins is get a B complex, take one pill, and that covers the whole spectrum of the B vitamins. Today, what we want to do is I want to show you some exercises that I like to do to help prevent some of this pain and to relieve some of the symptomatology that comes from overuse. My first one is I like to extend the wrist. So you put your arm at 90 degrees and then we extend this wrist back to a 90-degree angle. A lot of people can't get this far, so this is something you're going to take time in doing, and just pushing it this way and keeping your arm up like this. You can lay it on a table and do the same thing. The other thing is you want to flex it down, keeping it 90 degrees, making sure that the hand and wrist go at 90 degrees. If this hurts, don't do it. Only come as far as you can to feel a little bit of pressure and a little bit of discomfort. Don't force this. If you force it, you're going to create more damage to the area. But here's the little trick. When we exercise, we want to warm up the muscles before we start stretching them. We never, ever, ever, ever want to stretch a cold muscle. So how do we work on the muscles of the forearm and get them warmed up so that we can stretch them? Well, there's a couple of ways of doing that. And sometimes we can wrap some heat around there to warm them up. But the best way is movement and motion. You can do cross friction, where you can rub through this. That takes a little bit of time, a little bit of effort, and a lot of people, it hurts to do that, and you're only getting pinpoint areas when you're doing that as you stretch that muscle. What I like to use is a massage ball. I'm going to have this down in the description, so that way if you want one, you can order it. But what I like to do is place my arm on a table and rub on these muscles like this. And you don't want to do it for a long period of time. Maybe a minute, maybe 2 minutes. All you're doing is loosening up these muscles, warming them up, getting them ready for those stretches. The easiest thing to do is just push a little bit. Now, you don't want to push so hard where you feel like you're bruising yourself. It's just a light, medium pressure where you're pushing through all of this. After that, the muscles are nice and warm, there's less tension in them, and they'll flex further. This will also help with epicondylitis, whether it be lateral or medial. It helps with wrist pain, and a lot of times it will help with carpal tunnel type pain. That pain is not necessarily carpal tunnel syndrome. It can be an inflammation around the nerve caused by inflamed muscles, tight muscles, inflexibility. So by doing these exercises, you will see a big difference not only in flexibility, but in the decrease in pain. I talked earlier about immobilization versus stabilization. If you immobilize an area, and a lot of times doctors will recommend someone to put a brace on for this type of pain. I don't necessarily like braces because what they do is they end up causing the body to start losing muscle tone, or atrophy starts. As soon as you immobilize an area, it is going to start to atrophy immediately. Take for instance, if you broke your arm and you had to put a cast on it. As soon as that cast goes on there, the muscles start to atrophy. So when the cast comes off, you have to go to rehabilitation and you have to exercise those muscles to get them back to where they were prior to that injury. What I like to do is I like to stabilize that joint, which means if you stabilize it, you still have flexibility in it, but you're not preventing it from moving. And the best thing to do for stabilizing a muscle, not immobilizing, remember, immobilization causes problems. Stabilization allows you to still use the joint and allowing it not to atrophy. The best thing that I like to use is KT tape. Again, I'm going to have this in the description. Now, KT tape, people look at it, and you've seen these fancy KT tapes that people have had on their shoulders and on their knees and on their elbows. I'm going to give you an easy way to use KT tape so that you can put it on yourself and help stabilize that area so that way you can still use it and not cause more damage. The KT tape I like to use is pre-cut. It comes in about an 8-inch to 10-inch length. The easiest way to put this on, tear this just slightly. When it comes off, you have a little bit of this tape like this. What I like to do is I like to start at my wrist right here, right above that little joint right there. And I then start to pull it around. When you get about a quarter of a way or halfway, start to stretch it. Start stretching it so you can see that stretching like that. And as it stretches, you pull and roll that tape down. And just keep wrapping it and wrapping it until it's totally off. Pretty easy to do by yourself. And there it is. Now, this will stay like this for an extended period of time. You see, I still have flexibility in my wrist. I'm not immobilizing it. I can still use my fingers. All I'm doing is I'm stabilizing the area that is causing some of my pain. So again, I can flex and I can extend. Not as much because I am stabilizing the area, but I can still move it. So I'm not going to lose muscle tone and I will not start to get atrophy of my muscles because it's still mobile. The key is to keep mobility. If you've been listening to my show, you understand that I'm all about function. And the way to keep function is with movement. Well, guys, it's been a great show. I always love doing stuff for you. Hopefully you enjoyed the show. Again, please don't forget to subscribe to our channel. Hit that notification button to get future shows. I love you. God bless, and we'll see you next week.